So I walk into the ICU and the nurse tells me to go check on the patient in bed number 2. I see that the bed is covered with blood. The patient's knee is bleeding out from the behind. The entire bandage is soaked in blood and it is dripping down on the sheet. Within a minute, I'm bedside to the patient with all the things I need to stop this. Because if I don't, the patient will land up in hypovolemic shock, which is life-threatening. While maintaining pressure proximally, I open up the bandages to notice the situation. And yes, indeed, an artery is bleeding out. After using several techniques, I'm able to achieve hemostasis. I asked the patient, "Ki, how did this happen?" So he told me there were two people fighting in front of his house, and he got in between them to stop the fight. Instead, he accidentally got a knife stuck on his knee, cutting open the muscles, the ligaments, the tendons, as well as the artery which is supplying the leg, which passes right behind the knee joint. On close examination, I noticed that the limb is actually dying because of the poor blood flow. The changes that happened to the leg were irreversible, and as a result, within a few days, his leg had to be cut off because the tissues of the legs had been dead. Don't interfere between the fights that you're not a part of, because it might cost you more than just a limb.